I want to thank you for coming here today. We're going to spend the next few minutes talking to you about spinal decompression therapy, the benefits of spinal decompression therapy, and how we get you well, not just better, treating the cause, not just the symptoms. I'm also going to go over some general anatomy to teach you what it is we do, and we're going to go over some things on the screen behind me, which is also going to show you things that we do specific in our course of care. Most of you that are watching this have probably been through the epidural steroid injections, the pain medication, the narcotic pain medication, the muscle relaxants, general chiropractic care, acupuncture, and maybe even a surgery or two, and are still having problems. What we do here is to get down to that cause. And by getting down to that cause, we're able to get you well and keep you well. So here we're looking at a good vertebra. Here's the front of you right here. Here's the back of you. And if you notice, if you ever given a massage, you can feel those bones sticking out. Here we're looking straight down. There's the outer part of the disc with cartilage, and there's the liquid center portion. And that liquid center portion is what gives us our disc height. It acts as a shock absorber. Now it also gives us our area for the nerve to exit, as well as motion in the spine. These are called the facet joints. And when we have a nice big disc space, we have good motion. Why most of you, when you're having problems or you're having pain, you feel very stiff, you don't feel like you had the motion, you can't bend, you can't move your head as good as you were. Now we're looking at a disc that's become dry or degenerative, and you can see how this disc has lost its disc height. When that happens, the disc will bulge, either to the left, to the right, or what's called a bilateral bulge. This one you can see is a left greater than right. When that happens, it then stenoses or occludes, and it takes up that area where that nerve exits, creating the problem from that point anywhere on down. Now, as we start to compress and that disc loses its height and it starts to degenerate and lose the fluids inside, the disc material now oozes and sits on that emitting nerve, creating a stenosing or occluding of this area. Just as when we push down on a balloon. If I press on the balloon over here, it bulges to the left. If I press on the balloon over here, it bulges to the right. It also creates stiffness because these facet joints don't have as much motion to move because of the loss of the hydration inside the disc. What we're able to do in spinal decompression therapy is, since these discs are grown into the tops and bottoms of each of these vertebrae, we isolate one individual disc and only one individual disc by isolating on the computer, and then it creates an angle for that one individual disc, not that downward positive pressure, which caused that loss of hydration, caused that bulge, but a distractive force, which now isolates and creates a negative pressure inside this disc, allowing for these waters, nutrients, and oxygens, which are right outside the disc, to vacuum back inside the disc, to vacuum back in these protrusions or herniations, now giving us a nice big area for the nerve to exit. Now treating the cause, not just the symptoms, now getting you well, not just better, no medication, no injection, no surgery. You know, I like to tell people about, let's say the left front tire of your car goes low. Well, you can repaint the car, you can put a new interior in the car, you can put a new stereo system in the car. It's a pretty cool car, but you still have a left front tire that's low. Where's the air? Right outside the tire. Until you get that air from outside the tire back inside the tire, it doesn't matter what you did to that car, it's never going to run right. And then you have secondary problems with the car, the tie rod, the bushings, the bearings, the alignment, the tire itself, because you didn't address the cause. It's the same thing. You can take all the pain medication, you can do the epidural steroid injections, you can do the general chiropractic or the physical therapy or the acupuncture, but you're not getting to the cause, and that's the fluid from outside the disc, just like getting the air back inside the tire. What I want to do is show you a little bit about the low back. This is one of the main things we do in our clinic. We treat neck and low back. This is looking at your low back from what's called a side view or a lateral view. This would be your belly over here. This would be your bottom over here. We see that there's a great deal of motion in the spine, but if you were actually to look at just one little segment, not a great deal of motion in one segment, but orchestrated with all the other segments, they do very, very well. And that's important because we want to keep that integrity and that motion, which leads me into talking to you about spinal surgery. And first, I want to tell you about the success and failure rate of spinal surgery. Spinal surgery in a good candidate, described as age, height to weight relationship, and overall general health, is only successful 50% of the time up to 1 year, meaning the other 50% of the people are the same, worse, or have more surgeries. So if you're 40, 50, 60, 70, even 80 years of age, you don't even fall into that 50-50 category up to 1 year. Now that 50% that succeeded up to 1 year drops down to 15% successful at 8 to 10 years. If you've got some years on you, you can't even be in that 15% success rate, which doesn't give you very good odds of getting well. One of the things they do is what's called a laminectomy microdiscectomy. A laminectomy means that they go into this area right here and remove this bone in order to give a window for the surgeon to get to that disc. And then they do the microdiscectomy where they snip off this piece of disc to give you a larger area for that nerve to exit. The problem with that is there's still a portal of exit for that fluid to come back out. Usually at that point, the patient's right back where they were. And now the doctor is going to sit there and talk to him about another surgery, either to the level above or below, or even talk to him about a spinal fusion. When this disc dries or degenerates and it puts pressure on that sciatic nerve, the doctor will go in and is to make an incision and then plates, bolts, and screws and get the sacrum hooked up to this L5 so there's no motion in there. Now the problem is once we do this fusion, it creates what's called increased interthecal pressure to the disc above and below. Then that disc goes bad, the disc above goes bad, the disc above goes bad. Now we fuse another area, we fuse another area, and we fuse another area. You've got to try non-invasive procedures. You can't just do things that are going to mask the symptoms. You know, at first it starts with pain, then it goes to numbness and tingling, then it goes to motor loss. And they always progress because gravity is never going to stop acting upon us. Spinal decompression therapy and what we do to get you well, not just better, treating the cause, not just the symptoms. Now, when you notice that you have a good disc, you have plenty of room at what's called the facets, where the motion of the spine is. However, when we lose that disc space, that's when we start to get these facets too close and we start to lose our motion and we get real stiff. We're looking straight down at the disc, as if I was to cut you in half and I'm looking straight down. This is the front of you right here. Here's the bone that you feel to the back of your spine. Here's the outer part of the disc, which is cartilage. And here's the center liquid gel portion. And we can see how that liquid gel portion is sitting on that nerve and stenosing or occluding that nerve, not giving us enough room for that nerve to exit. If we look over here, this is a nice big area for that nerve to exit. So if you have problems or pain on both sides, this would be on both sides, whereas this one is showing a left greater than right. Now, if we try to look into this hole like this, it's as if now I turn you sideways and we see that same bulge occluding or stenosing that area, not giving us enough room for that nerve, with this loss of disc height as opposed to the disc right above, which is nice and big, with a nice big hole for the nerve to exit. Now we must remember that these discs are grown into the tops and bottoms of each of these vertebrae. We must remember that it's this downward pressure on that disc that causes that loss of hydration and causes that bulge. And we've got to remember that we're about 70% waters, nutrients, and oxygens. Everything that used to be inside that disc is right outside the disc. It only takes the weight of a dime for you to have the problem from that point anywhere on down. So what we do is we tell the computer to distract this individual vertebra this way and to distract this individual vertebra this way. And in doing so, this creates a negative pressure inside that disc, which allows for these waters, nutrients, and oxygens to vacuum back inside a disc. It allows for these protrusions or herniations to vacuum back inside the disc, now giving us a nice big area for the nerve to exit. I want you to watch right here as I distract these two individual vertebrae. The disc material starts to vacuum back in, starts to take the pressure off the nerve, gives us more fluid inside the disc, now giving us a nice big area for the nerve to exit. You've got to try non-invasive procedures. You can't just do things that are going to mask the symptoms and just make you feel good temporarily. You got to get well. And again, the only way to get well is to treat the cause. I want to thank you for coming in today. I hope you've learned a lot, and your doctor will be with you in a few minutes, and we're going to look forward to getting you well as we have hundreds of people before you.